Today on our weekly briefing. I just have a few short remarks and updates, and then we have Dr. Mendoza, and then we're happy to take some of your questions. As we heard today from the governor, the Finger Lakes region, as we talk about every day with you all, is the highest in the state in positivity rate and hospitalization rate. Our positivity rate is, as a region, was 8.3%. The hospitalization rate is 0.06%. Our numbers continue to trend in the wrong direction. Yet again, yesterday we saw a record high number of new cases at 729. We also sadly lost 16 more people in our community after reporting 23 new deaths on Wednesday. These deaths reflect not just single day, but over a course of several days. But this is, and I think we can all agree, there are far too many families suffering loss in our community. And it's tragic. And we all need to come together to support those who have lost loved ones to this virus, to prevent the further loss of life in our community. We're about to approach the holiday season, and there are over 400 families in our community right now who are grieving the loss of a loved one because of COVID-19 in our community. And we need as a community to honor them and to show our sorrow and solidarity with them by doing the right thing, by doing our part to slow the spread of this disease in our community. New York State so far has not changed our current zone designations for Monroe County. So portions of the city of Rochester, town of Brighton, parts of Gates and Greece remain in the orange zone, with the majority of the rest of the county being in the yellow zone. Dr. Mendoza and I, along with leaders throughout our region, are continuing to stress that we need to keep and limit our gatherings only to those within your household. Wear your mask and keep 6 feet physical distance. We understand that this message might be tiring and might be getting old, and that COVID fatigue is real, and that we have it, but we have to continue to follow these guidelines. Our hospital systems are doing an incredible job. We meet with them on an almost daily basis right now to talk about their surge capacity and how much and the capacity to treat COVID patients within their walls. And they're doing a fantastic job to do it, and their staff is doing a fantastic job as well. But we need to make sure that we are as healthy as we can be as a community to keep those numbers down within the hospital systems. Because being in hospital, the hospital capacity is more than just about beds. It's our ability to staff beds. It's our ability to make sure that our healthcare workers are healthy and safe as well, so that they can continue to work within those systems and keep our families safe. So we really need to work together as a community to make sure that we're doubling down on those efforts. With next week being Christmas, we are facing yet another challenge as a community as to how we celebrate yet another holiday where we want to be together, we want to spend time with our family, but we also know that it comes with risk. Over 70% of the infection rate, the infections in our community are coming from small social gatherings. It's not unique to us here, that's around the state. We have to understand what those risks are as we head into the holiday seasons. And I know we want to be together. And we are social beings, we are social creatures, and we want to be with our friends and our family and celebrate the holiday as we usually do. But that's just not possible. And we need to understand what those risks are so we prevent the spread of this virus from those who are most endangered from having a severe disease. As we always talk about with the vaccine around the corner, the light is at the end of the tunnel. And I just heard it said before, it's a long tunnel. We're not there yet, but we see how this ends. We see that by this time next year, by next summer, in just several months from now, we're going to be in a much different position than we are today. We just have to get to that date. We just have to get there. This could be the last series of holidays like this where we have to make these types of severe adjustments. But we want to make sure that our family and our friends are still with us when we get to that point. And to do that, we have to work together. To do that, we have to understand the risk, and we have to get our numbers back down. We're in a serious situation right now where our numbers are just too high, and we have to work together to bring them down. University of Rochester Medical Center and Rochester Regional are continuing to vaccinate their frontline staff, and I appreciate their transparency around that and their communication with the public. Just this week, we announced the COVID-19 vaccination task force. led by Dr. Nancy Bennett and Wade Norwood. The task force is beginning to take shape, and I know we're going to have some good announcements early next week as they continue to build out the membership of that task force, make sure it's inclusive, and that we start to build that data and transparency into the process so that we all understand as we move forward how much vaccine is in our community, who's receiving that vaccine, where we are in the phases, and we can answer all of your questions as this continues to play out. So with that, I'm going to hand over to Dr. Mendoza to provide his update.
Thank you, County Executive Bello. And I want to echo the sentiments around the vaccine this week. For many of us here in Monroe County, across New York State and across the country, this was a very exciting week that we now have a vaccine that is safe, that is highly effective here in our communities, now being administered to frontline healthcare workers right here in Monroe County, is news that we have all been waiting for. The last 9 months have been trying, to say the least, but I think the vaccines now being here in our community represent an opportunity to turn a new page in the COVID-19 pandemic. That being said, I will also acknowledge that this optimism and excitement is not universally held across our community. There are many people right here in Monroe County who are still uncertain, who have fear, and rightfully so, because this process to develop and distribute this vaccine has been like no other in the history of vaccines. And so to all of you, spanning every walk of life, every community, every race, ethnicity, socioeconomic status here in our community, to those of you who are uncertain, I pledge to you today that my job for the coming until the end of this COVID pandemic, my job is to help you to understand all of the things that you need to understand to have you ask, and I'll answer all of the questions in one form or another so that you can make the best decision for yourself, for your loved ones, and your family. Because at the end of the day, we need to figure out how, as a community, we can reach the 75% immunization rate that most experts currently believe is what is necessary to achieve herd immunity that will then allow us to consider reopening everything more fully, much more like the normal that we all long to have. And so while we work to that, I again want to invite anybody who has questions about this to please ask them. There is a lot about this vaccination program that is still yet to be developed. And while we develop it, your input right now is so critical. So please do not hesitate to share your thoughts and input with us. Dr. Bennett, Wade Norwood, the county executive, and I are all ready to field your questions and concerns. But let's navigate the next 9 months in the same way that we navigated the previous 9 months, by following the data, by seeking information from reliable sources, and by having conversation with one another so that we can all be comfortable and work together as a community to undertake what I believe will be the largest public health undertaking of our generation. So with that, I will turn it back over to the county exec.
Okay, first up is Kayla Green from WROC.
All right, good afternoon. So I have a question regarding schools, just as we go on winter break here soon. Do you have concerns about students coming back to school with the possible gatherings that could happen over the holidays?
Yeah, so this is why we need to have this conversation now, and families have to start preparing for how they're going to handle their Christmas holidays. Because as we saw with our school testing and what we saw earlier this year is that transmission within schools is very low. We always talk about that, and I still believe that. Being in school is very safe, but that doesn't mean children and teachers, administrators aren't getting sick. It just means that they aren't spreading it amongst those school buildings. So our children are certainly at risk over this holiday, particularly if we're having large gatherings in small confined areas without wearing masks. So there's certainly that risk is there. I have that concern. And that's why we need to do everything we can to mitigate that risk and also understand the danger of asymptomatic carriers that can make families sick and can still spread the disease while not showing severe symptoms themselves.
And I'll add to that we don't want to take for granted all of the precautions that our schools have undertaken. The reality is that as the community transmission rate in Monroe County goes up, the mere statistics of it all would suggest that it becomes more likely for transmissions to happen in the schools. And to date, we're not seeing that, but that's not something we need to take for granted. And I also want to remind everybody that our schools are not just the students, it's the teachers and the staff. And these teachers and staff, just like our students, are seeing more positive cases through transmission in our community. And we cannot take that for granted, because it doesn't take very long, as you saw earlier this week, for critical services within a school district to lead to district-wide action. And so that is an example of something we want to avoid, particularly in the coming calendar year following the holidays.
Thank you. And then as a follow-up, where do school officials and teachers and administrators fall in the vaccination process, and how might them getting vaccinated kind of, I guess, change the game a little bit?
I don't know if Dr. Mendoza, I'll tell you this in terms of where they fall. Teachers, school officials are in phase 2. After you work through healthcare professionals, clinicians, long-term care residents and staff, and nursing home staff, EMS, and first responders, teachers are then part of their phase 2. So we're not that far away from that, being able to do that. Depends, there's some really good news this week from Moderna and the FDA, and I think that as more vaccine becomes available, the quicker we get to those phases. I'll let Dr. Mendoza talk about the how that may impact transmissibility though within the school building.
So it's great that the teachers and staff in general will be tier 2. I have said that school nurses should be considered among tier 1. The challenge before us is plucking out the schools from all, or the school nurses from all of the schools to get them in line to get their vaccine. But the majority of school staff and teachers will be in tier 2. But remember that these vaccines have been approved only for age 16 and above. So the vast majority of our K through 12 students will not be eligible yet to have this vaccine. So vaccinating the adults is a great first step, but obviously if we can't vaccinate the children, then the children need to rely on us as adults to do our part to help to keep them safe until the day comes, which we think will likely be toward the end of spring or early summer next year, when children younger than 16 will be eligible to receive the vaccine.
Great. Thanks, Kayla. Next up is Patty Singer from the Minority Reporter.
Oh, the question about the vaccine, particularly with the Pfizer, because of the handling that's required for that, and the fact that at least one of the health systems had not yet run its simulations before it had even started administering the vaccine, what is the concern about losing doses because of mishandling, and then we're not getting the full benefit from that?
Well, the reality is with every vaccination implementation, there's a lot that we learn as we go. You may be aware that it was initially thought that the vials would each contain a certain number of doses, and it turns out in practice that you can get 1 or 2 more doses out of each vial. And so that's an example of how data and evidence and experience will lead us to adapt our practices. We're certainly aware of the potential to waste vaccine, but that typically occurs when you are administering 1 or 2 from a vial that then needs to be discarded if it expires. But the reality is, with COVID-19, none of these vials is going to sit around long enough to expire. So I have every anticipation that the hospitals are highly motivated to avoid waste whenever possible.
As a follow-up, as we're seeing the number of cases and what would appear to be a nursing home population rising, and we all understand that the nursing homes are overseen by the state. But Dr. Mendoza, do you have any frustrations as you see these numbers rise? The state handles nursing homes, but this is happening in your community. What do you say to the families of the folks residing in nursing homes where cases are in now the dozens or more a day?
So, I appreciate and respect that the State Department of Health has the regulatory authority over our nursing homes. But quite frankly, these residents are residents of the community and the county that I serve. So I don't really pay much attention to who regulates the nursing homes. I care about them just as much as anything else here in Monroe County. And to that end, I will do everything I can to advocate on behalf of nursing homes in our county. In response to seeing these increasing numbers, the ages of people continues to be in the 70s, 80s, and 90s of people who we're losing. Some of them are nursing home residents, many of them are not. But equally so, I want to make sure that in the nursing homes, that we learn from what we experienced back in April and May. We want to emphasize again proper use of PPE, making sure they all have the supplies that are necessary, making sure that they're paying attention to their staff, ensuring that they're not coming to work when they're sick, making sure that staff observe their quarantines if they are under quarantine. And we pay special attention to our staff to ensure that they're not having unnecessary gatherings in their homes. So I am very concerned about this because we certainly do not want to see a replay of what we saw in April and May.
Thank you.
Great, thanks. Next questions for Lowell Rose from Spectrum News.
Hi, Lowell Rose from Spectrum. My question is more so for Dr. Mendoza. When it comes to hospital capacity, I know the governor said today that no hospital has reported that we could reach that capacity, but what plans do we have in place for our region as far as the networks? If hospitals get to that point, where would those patients go to? What are the plans to expand beds and things like that?
So as we've explained in the past, the hospital capacity number is a very fluid number. It can change on a daily basis, even more than that, based on the types of patients that we admit. And to some degree, we can control that through the cancellation of procedures or surgeries that may be elective in nature. We can also shape that by how we discharge patients and the kind of follow-up that we identify. We can also influence that through primary care in how we can identify cases earlier, manage certain things outside of the hospital when appropriate. But we're having daily conversations with the hospitals about that, because that is the metric that I care the most about. Because if our hospitals are no longer able to manage our population safely, that would be a very grave concern that I would have for the health of our county. So we work with them very closely, and we're following those metrics now, and it is true that we are not yet there. But I want to encourage the public to appreciate that the number isn't simply a number that you can just sort of set and watch and not do anything about. We've got to actively manage this number to make sure that we have the necessary capacity for our community.
And I know this week you also got the vaccine, and you're talking about how the public feels about the vaccine. How do you feel after getting it? Are you seeing any side effects, anything from the vaccine?
I got it on Wednesday morning, and I think as of yesterday afternoon, the arm soreness that I had, that was the only symptom I had that had already gone away. So right now I feel a sense of optimism, of purpose, honestly, because that we in healthcare have gotten the shot, have started to get the shot. It just reminds me that we have so much more work to do together as a community. And I do not want to take it for granted that there are a lot of questions about this. And these questions span every possible demographic in our community. And I also don't want to assume that just because somebody may have an opinion now that they're not willing to change their mind. I think most people in our community, and we've demonstrated this time and again throughout the pandemic, most people, when presented honest information from valid sources, will make a decision for themselves that is in their own best interest. I think that's our own human nature. And I have every anticipation that if we can create the environment in this county like we did earlier this year to flatten the curve the first time, I am optimistic that we can do this again.
One quick question about the vaccine. When do you expect healthcare workers, nursing homes to be complete? And when do you foresee the possibility of the general public receiving the vaccine here in the county?
Well, completion is highly dependent upon acceptance. And, we can't just assume that everybody who is offered the vaccine will get it. But I won't consider Tier 1 complete until everybody's accepted it. So it may last for some time. But I do anticipate that Tier 2 should start by the end of January. And then the general public, I think it's really too early to say because it highly depends upon the approval of additional products. We're on track right now to have only 2, which is Pfizer and Moderna. But as the other ones come online and as their supply chains open up, conceivably, we could have the general public Tier 4 and 5 up by, April or May.
Okay, next we have Berkeley Breen from News 10.
Thank you, Steve. Dr. Mendoza, When we were coming out of the pause in May and June, our region was the best, if not among the best, and now statistically we're the worst. How do you explain that?
So that is a question of intense debate. And the way I think about that now is that because we had such a low rate for the majority of the summer, a large proportion of our population remains susceptible. The natural immunity that you derive from the infection was one that we didn't have a high prevalence of because we had relatively few people in our community contract the infection naturally. So that, combined with the usual predictable increases with seasonality, coming indoors, colder weather, and so forth, meant that the pendulum swang further in both directions, if you will. And so we had a highly susceptible population going into the winter, and that's why we have, to some degree, the highest numbers in many ways across the state now.
Thank you. Question for either you or Adam. In the governor's briefing today, the Finger Lakes numbers were in red, literally. They were made the color of red. And I'm wondering, what is saving our region from going red? And is it something that you are telling the governor and his people?
Well, I can say that, well, the metrics for changing how, that's a really good question. The metrics for how they designate the zones have changed over the last couple of weeks. And right now, the metric for going red is completely based on your hospitalization, or largely based on your hospitalization numbers and the ability of the hospital system to stay on top of who's in the, who's their admittance. Right now, our hospital systems are doing a good job, and they're staying on top of it, and there's no immediate danger that we see right now with the trend lines in the next couple of weeks of them reaching their full capacity. Having said that, though, there is a problem here, and I acknowledge that, and I think we all do, and it should be in red, the number, because the numbers are too high. And we went, going back to the previous question just a couple months ago, we had one of the best numbers, not just in the state, but in the country. I think Dr. Mendoza laid out real well why he thinks that that's changed. But we clearly our numbers are clearly higher than we would want them to be. They're clearly higher than they should be. And there is a stress on the hospital systems. They haven't hit the capacity yet, but there's clearly a stress. And we're also seeing it because there's also two numbers that don't change reflective of your testing. You know, because you always have that debate: are you testing enough? Are you and how does that relate to your positivity of your numbers? And the numbers and the rate are two things that could change based on how much testing you're doing, how many positive cases and what your rates are. And, you know, and that's reflective in the fact that over the weekends or on holidays, you'll see these fluctuations. That's why we look at a 7 or 14 day running average. But there's two numbers that you can't get away from regardless of how much testing you have. It's your hospitalization number, and it's the number of deaths that you have and fatalities. And the hospitalizations haven't reached capacity, but they're high, and we've lost a lot of people in the last several weeks and months going back to it. So I think it's red. I think that the numbers are flashing red, even though that might not be the zone designation. And I would assume and imagine, and I would hope that the designations are reevaluated in the next several days, as we look at and be able to really look at in a more granular level, where are those hot spots if we're still seeing hot spots, or is this really still just contributed to the 70, you know, as we see the 70% being contributed to small gatherings? And if it continues to be what we see, which is the spread among small gatherings, then we really just have to recognize as a community that there's more to be done, and we have to work together to do it, because you can't shut down your way out of that, right? If the disease is spreading in living rooms, and it's spreading because we're having people over to our homes and mixing households and not wearing our masks, you know, you can shut down as much as you'd like, but that's not going to change that one factor, right? So that's why this is a real community effort. It's a community problem. They changed the barber shops and salons by looking at the data, and allowing them to open in the orange zone with the testing. I think that was the right thing to do, and I'm glad they did that, and that again matched what the data was that we're showing. But if the data is showing it's coming from small gatherings, that's very difficult to enforce. We instead just need to, I think, come together as a community, implore people to do the right thing.
Thank you, Berkeley. Next is Brian Sharp from the Democrat and Chronicle.
Thank you. This question's for Dr. Mendoza. I think the city school district is having a press conference starting about now, where we're expecting they're going to be talking about reopening. I'm wondering what role you had in reaching such a decision, and what has changed from 3 or 4 months ago to make that a good decision now where it wasn't before.
Well, I'll share that I have no idea what they're about to announce. I met with the school board, I think that was last week, and I shared my view, which is that I believe that the city schools and their students should be engaged in in-person learning. Given the experience that we've accrued in the schools outside of the city, given the fact that we can very safely have kids in person with the right precautions, my conclusion was that there was really no public health reason for the schools in the city to no longer be, at least in some fashion, in person. That being said, I will be the first to acknowledge that there are unique challenges in the city, challenges that we don't experience in the same way in other parts of our county. So I've always put myself out to the superintendent of schools, Myers-Smalls, that I'm a resource. I'm happy to provide guidance and clinical advice. But at the end of the day, this is a tough decision that she needs to make with consultation from her board. So, but from my standpoint, whatever the decision, I'm here to support the kids in the city.
You have a follow-up, Brian?
Yeah, one other one, I believe this would also be for Dr. Mendoza, is just, we've talked about hospital capacity, and I'm just wondering, I guess again, sort of like last week, where you're at and able to, or where we are at and able to meet both demand for testing and the numbers, as we see again, another day record number of cases for contact tracing. If some folks just aren't being gotten to, the numbers are just too great.
Yeah, I think the challenges continue with contact tracing. Remember that case investigation is the first step, where we reach out to all people who are positive. Again, when we reach out to them, because of all of the inherent delays, both within the health department and in the testing sphere, most people are aware that they're positive. We've been working with the schools to develop guidance for families on how to approach sort of those initial 12 to 24 hours of finding out that you're a positive case. We're working on trying to develop education like that for the general public. It's not meant to be a substitute for our work. I take responsibility for trying to make sure that process is as efficient and timely as possible. But it is challenging. We still continue to get people who are not cooperative with the process, and we work with that. But make no mistake, with the numbers that we're seeing, no county in the state is able to keep up with them. And I think, frankly, in conversations that I have with my counterparts, we're staying ahead, believe it or not, better than many of my other counterparts of counties of similar size. So that being said, I'm going to keep working because at the end of the day, I want us to be the best, and we've got to work to get there.
All right, next is Andrew Banis from 13 WAM.
Hey guys, thanks for doing this. Hope you're doing well. Wanted to first ask about reports we're hearing that some staff in the emergency departments of local hospitals have not been given the vaccine yet or been offered that vaccine. Can you explain why that is? Is there a reason why they're waiting for that?
So the details for how the different hospitals have implemented the Tier 1 guidelines is really within their four walls, and I can't speak to the details of how they did that. But the reality is, we've only gotten some, hundreds or low thousands in terms of vaccines in this community, and my estimate is that we have 50,000 people in Tier 1. And so it doesn't work to have everybody at the front of the line. So they've got processes in place, which I hope have been driven by actual risk. People who are in the hospital taking care of people who are sick and so forth. But there is obviously some component of random selection. And so I would defer you to my colleagues at the hospitals if you're interested in the details of how that took place.
Follow up, and thank you for that. Follow up is we really talked a lot about Thanksgiving and the spike we saw on Thanksgiving, urging people not to gather. Christmas is a week from today. The governor today said he's confident people learn from that. New Yorkers learn from that. Do you share that sentiment? Are you confident that we won't see the spike from Thanksgiving, something similar happen in the week or two after Christmas?
Well, I'll start. I am confident. I'm confident in everybody who lives here is going to do the right thing and that we're going to come together as a community. I have nothing but faith and confidence in our community. And I think by and large, we did a good job around Thanksgiving. The increase in the numbers that we saw in terms of the case volume and the number of positive cases started going up right before Thanksgiving. And, I think in my view and Dr. Mendoza, I think will agree, is that it was probably coming off of Halloween and just part of that natural surge that we're going to have as you come off the summer months. We're coming inside, we're mixing indoors more, and the numbers went up. There wasn't really an identifiable surge particularly linked to Thanksgiving when it came to the increase in numbers. However, what we did see right after Thanksgiving was an increase in the hospitalizations. And so you could look at it one of two ways. Was there an increase in the total number of positive cases linked to Thanksgiving, or was the increase in positive, or was there a surge there? I don't think so, a full surge there, but was there a full surge in the hospitals? Yes. And so it may have been amongst a different type of population that might have been most at risk. So I am confident that Monroe County residents are going to do the right thing. I am confident that we're going to keep our numbers down and avoid a surge. And it's because we're having conversations like this. But make no mistake, the hospital numbers are too high. And the number of people who came into the hospital who were very, very sick after Thanksgiving was too many. And so we have to make sure as we get into the holidays here with them upon us that we're understanding what the risk is, but we also understand that we need to keep the disease away from those who are most vulnerable from a serious outcome. And we know what those are. It's residents, our senior residents with comorbidities, and things of that nature. We have to do what we can to keep that population safe.
And the one thing I'll add is that Halloween was basically one day, one weekend. Thanksgiving was an extended weekend. But what we're looking at here in December is essentially a month-long holiday. For 3 weeks in a row, we've got reason to gather. We've got holidays that are significant holidays for many people in our community. And in the way that we might have been able to see a quote surge after Halloween and potentially after Thanksgiving, we're not going to have enough time between the holidays in December to be able to discern if there's a surge. And so we can't base our behavior based on data, because the data are going to occur after any changes in our behavior might be necessary. So we have to do the right thing because it's the right thing to do. And we won't get the feedback from numbers until well into January. And I think that is what makes this particularly challenging. But it's also the reason why I think I have a lot of reason to be optimistic, because after looking at what happened in Halloween and Thanksgiving, numbers didn't increase as much as I had feared. And I had said earlier that I was planning for an increase of 100 per day for the better part of December, and we haven't yet seen that, thankfully. So I am optimistic. I do think people are paying attention. I do think people are taking this seriously by and large.
Thank you, guys.
Next is Randy Gorman from WXXI.
I am actually all set. Thank you, folks. I appreciate it.
Thanks, Randy. And last but not least is Will Astor from the Rochester Beacon.
Okay, here, sorry, I'm muting. Dr. Mendoza, do you have, what are your projections now based on what you have seen for when we might start to flatten the curve?
The complication with these models is the minute you see a model and do something in response to the model's now wrong. And so I think it's just premature to try to predict what will happen. I think we have to acknowledge that the way the model will shake out is entirely in our hands as a community. You know, I've said it before, we hold the future of this pandemic in our hands, and in months it will be in our arms. But we have to take this very seriously. I do think that we'll have to at least get through January, you know, to see, because every year, even without COVID, we know that January is a tough time from a volume standpoint in the hospital. So I think drawing any conclusions before the end of January would be premature. But I think come February and March, depending on how influenza season pans out, which is, you know, still in its early phases, I think it's safe to say that we're not seeing the numbers that we typically see with flu this year. But jury is still out. You know, we'll wait and see what we see in January and February, and I think we'll have a better sense at that point about what March and April will look like.
And to clarify, both Dr. Mendoza and Bello are expressing optimism and giving the sense that the reality hasn't turned out as bad as you might have projected. But are we still heading in the wrong direction insofar as the numbers are going in the wrong way?
I will say that they are going in the wrong direction. To say that they're not going in the wrong direction as fast as I thought they might doesn't make it good news. It just makes it less bad. So I think we need to redirect our behavior. We need to double down on these measures. You know, losing this many people every day is never good news. You know, that it could be worse is shirking our responsibility at what we ought to be achieving and striving for, which is improvement. And that's really what we're here to do.
And I'm sorry, I think that was the last question. Well, I didn't quite hear, I wasn't able to hear your question, but I think it was about, are we heading in the right direction or wrong direction? I'll echo what Dr. Mendoza said. I think the numbers are not good. They're not heading in the right direction right now. But in terms of my optimism is, it comes from the sense and belief that we've done a lot of hard things over the last 9 months. And I believe that we are prepared to continue to do hard things to get it back in the right direction. Like, this isn't going to be easy, right? Every family wants to get back to normal, particularly over the holidays. And as Dr. Mendoza said, we have compounding holidays right now, and this is where this is going to be a particular challenge. But I think by and large, over Thanksgiving, we did do the right thing. There wasn't that dreaded, it wasn't the exponential curve growth week after week after week like we thought there would be, but that's not to say that the numbers aren't too high and we're not in the right direction. So we do need to have a little bit of a course correction here in terms of doubling down on our behaviors, making sure we're doing the right thing. Also understanding that you can do the right things. You can wear your mask, you can keep socially distanced, but still acquire the virus through some other, you know, because, you know, it came from a family member who you do live with, you know, and or you know, you are following the rules, but you know, our kids are playing sports. There's other areas where you can get the virus from. So we also have to remove that level of shame and judgment that sometimes we have towards each other when you become sick. That's not helpful. What is helpful is reaching out to people who are struggling. What's helpful is reaching out to neighbors who could catch the virus and have a bad consequence if they went to the grocery store, and ask how you can help them get their groceries and cut down on going to those unnecessary trips. That's how we help each other. And given this holiday season and how giving and caring our community is, I think we're going to get there. And I have all the faith in the world that we're going to reach out to our neighbors and find out how we can help them stay safe. So with that, thank you all very much. I appreciate it. I hope you have a great weekend, and we'll see you again next week.
Thank you.